dexchlorpheniramine. Educational use only, not a substitute for medical advice. Dexchlorpheniramine, complete detailed drug monograph. No. 1. Generic name, drug class, brand names, and drug forms. Generic name, dexchlorpheniramine, also known as dexchlorpheniramine maleate. Drug class, first-generation antihistamine. Chemical class, alkylamine antihistamine. Belongs to older generation H1 blockers with sedative and anticholinergic effects. Common brand names, polaramine, Dexchlor, Allerchlor, various generic formulations worldwide. Available dosage forms, tablets, 2 milligrams, extended release tablets, capsules, 6 milligrams, 12 milligrams, oral syrup solution, 0.5 gram 5 milliliter, 1 milligram 5 milliliter, depending on manufacturer. Injectable forms, rare, mainly outside US. Combination cold allergy products, dexchlorpheniramine plus pseudoephedrine, dexchlorpheniramine, dextromethorphan, dexchlorpheniramine plus codeine in restricted countries. Number 2. Definition. Dexchlorpheniramine is a potent first-generation H1 antihistamine used to treat symptoms of allergies such as sneezing, itching, runny nose, hives, watery eyes, and allergic skin reactions. It works by blocking the action of histamine, a natural chemical that mediates allergic responses. Number 3. Mechanism of action. Primary action, H1 receptor antagonism, competitively inhibits histamine binding to H1 receptors in respiratory tract, gastrointestinal tract, blood vessels, skin. Pharmacodynamic effects, reduces capillary permeability, less watery nasal discharge, decreases itching, pruritus, decreases vasodilation, less nasal congestion and redness, reduces smooth muscle contraction in bronchi and GI tract, mild effect. Sedation and CNS effects. Being a first-generation antihistamine, it crosses the blood-brain barrier, causes sedation, drowsiness, decreased alertness, impaired psychomotor performance. Anticholinergic, antimuscarinic effects, dry mouth, dry eyes, urinary retention, constipation, blurred vision. Number 4. Pharmacokinetics. ANI. Absorption, rapid and well-absorbed orally. Onset of action, 30 to 60 minutes. Peak plasma levels, 2 to 6 hours. Distribution, widely distributed throughout body tissues. Crosses, blood-brain barrier, placental barrier, protein binding, high. Metabolism, primarily metabolized in the liver, hepatic metabolism. Involves cytochrome P450 enzymes, mainly CP6, varies by population. Elimination, excreted mainly in urine, unchanged or as metabolites. Half-life, adults 12 to 24 hours, children shorter, 6 to 12 hours, elderly prolonged due to decreased clearance. Number 5. Uses, therapeutic purposes, allergic conditions, allergic rhinitis, hay fever, perennial rhinitis, allergic conjunctivitis, allergic skin reactions, urticaria, hives, contact dermatitis, atopic dermatitis, itch relief, insect bite stings. Other uses, cold symptoms as part of combination therapy, histamine-mediated reactions, adjunct for drug-induced reactions, non-anaphylactic. Number 6. Indications. Dexchlorpheniramine is indicated for relief of symptoms associated with upper respiratory allergies, relief of itching and hives due to histamine release, symptomatic treatment of common cold in combination medicines. Number 7. Contraindications. Absolute contraindications. Known hypersensitivity to dexchlorpheniramine or other alkylamine antihistamines, MAO inhibitor use within the last 14 days, newborn or premature infants, risk of respiratory depression, breastfeeding, drug crosses into milk. Relative contraindications, use with caution, narrow angle glaucoma, severe urinary retention or benign prostatic hyperplasia, pyloric stenosis or peptic ulcer with obstruction, severe asthma attack, severe hypertension, especially with combination products, coronary artery disease. Number 8, precautions before taking this medicine. Medical conditions to disclose. Tell your doctor if you have liver or kidney impairment, hyperthyroidism, seizure disorders, COPD, asthma, or chronic bronchitis, heart disease or arrhythmias, enlarged prostate, glaucoma, urinary retention, pregnancy or planning to become pregnant. Precautionary measures. Avoid alcohol, increases sedation. Avoid driving, operating machinery. Older adults, higher risk of confusion, dizziness, falls. Children, risk of paradoxical excitement, restlessness, hyperactivity. Number 9, how to use. Take exactly as prescribed or as per package instructions. Tablets, swallow whole with water. Extended release, do not crush or chew. Syrup, use a proper measuring device. Can be taken with or without food. Number 10, dosing information. Adults and children to 12 years, 2 milligrams every 4 to 6 hours, not exceeding 12 milligrams per day. Extended release, adults, 6 milligrams every 12 hours, maximum 12 milligrams a day. Children, doses differ by formulation and age. Always follow pediatric dosing instructions. Children 6 years, only under medical supervision. Number 11, missed dose and overdose. Missed dose. Take the dose when remembered. Skip if it's almost time for the next dose. Do not double the dose. Overdose symptoms: extreme drowsiness or agitation, dry mucous membranes, dilated pupils, rapid heartbeat, hallucinations, seizures, respiratory depression, possible coma in severe cases. Action: seek emergency medical help immediately. Number 12. Stop or avoid taking. If you develop allergic reaction, swelling, rash, breathing difficulty, severe dizziness, fainting, heart palpitations, confusion or hallucinations, vision changes, possible glaucoma issue, symptoms persist 7 days without improvement. Number 13, side effects. Common side effects: sedation, drowsiness, dry mouth, nose, or throat, dizziness or lightheadedness, constipation, blurred vision, urinary difficulty. Less common: nausea, vomiting, headache, nervousness or restlessness, thickened bronchial secretions. Serious adverse effects: seek medical help, irregular heartbeat, severe allergic reaction, hallucinations or seizures, difficulty breathing. Number 14, vital information, may cause significant drowsiness. Avoid alcohol, opioids, or sedative CNS depressants. Elderly patients may experience delirium, confusion, or falls. Do not use with other antihistamines at the same time. Number 15, drug interactions, other drugs that will affect it. Major interactions: MAO inhibitors, contraindicated, severe reactions. Alcohol, increased sedation. Opioids, respiratory depression. Benzodiazepines, diazepam, lorazepam, excessive sedation, barbiturates, sleeping pills, tricyclic antidepressants, other anticholinergics, atropine, scopolamine, CNS depressants of any kind. CYP-D6 inhibitors can alter drug processing. Drug classes that may interact: antipsychotics, antiepileptics, muscle relaxants, blood pressure medications, anti-anxiety medications. If you want, I can also prepare a patient-friendly leaflet, a doctor-level monograph. Thank you. Have a nice day.